Welcome to Chewy Tubes and the Jaw Rehabilitation Program here at ASHA. Chewy Tubes are an oral motor tool designed to develop up and down jaw motion, which of course can then be used in speech production and oral feeding skills. Let me introduce you to the Jaw Rehabilitation Program. The JRP is a series of goals and objectives designed to develop excursion and closure of the jaw in a very rhythmical and repetitive manner. The JRP is a series, I don't know if you can see this, of goals and objectives. There's 7 levels of therapy. Each level has 2 long-term goals, and each long-term goal is in a box with all the short-term objectives. I encourage people to use the program, take the goals and objectives and use them in your IEPs and in your patient treatment plans and with your parents in home care and in your families in home care programs. Let me introduce you to Chewy Tubes a little bit more specifically. We have the yellow and red Chewy Tubes, which were originally designed to be used with the Jaw Rehabilitation Program. And as you can see, they are tubular and are meant to be presented laterally into the jaw. The yellow Chewy Tube is the narrowest diameter, so this would be used in the pediatric population with very young children, and then on the other side of the spectrum in the adult population with patients who maybe need to maintain or develop this muscle strength in the masseter to preserve their oral feeding skills. The yellow and the red are used a lot in stroke rehabilitation, TBI, and also with patients who are status post radiation treatment of the jaw. In addition, we move up then to the knobby tube. If you're working in the preschool or the early intervention area, you might begin with the yellow Chewy Tube, progress to the red Chewy Tube, move up to the green knobby tube. And then for our youngsters, particularly those with ADD or perhaps some sensory issues, as they're moving into the preteen or the teen years, they may progress to the blue Chewy Tube. This is our firmest Chewy Tube, and many patients need this type of stimulation. Our P's and Q's are solid and offer some opportunity to grip onto them by young and older patients alike. And then we also have our Super Chews available. These are also solid tools and again provide a smooth surface for biting and chewing, and the knobby surface also for biting and chewing. There's lots of information at chewytubes.com. I have a video there of 5 minutes which will take you through all of the Chewy Tube tools and their uses in the pediatric and the adult population, and also there's information on the Jaw Rehabilitation Program. So hope you've had a great time at the ASHA convention. I know we certainly have, and our best from Chewy Tubes.